Hello everybody, I'm Dr. Sudip Chowdhury. I'm a pediatric endocrinologist working with the medical clinics. By pediatric endocrinology, we mean that we deal with children who have hormone issues and diabetes. Today, I'll be discussing about a very important issue regarding pediatric diabetes. As we know that India is sitting on a living time bomb of pediatric diabetes. Every day we are getting more and more cases of type 1 diabetes in children, which is sad, but in a way it is a good news. It is preventable in some instances. Let's have a quick overview of what exactly is type 1 diabetes. Now, type 1 diabetes is a condition in which your child doesn't produce enough insulin. Many of you may have heard of this hormone. It's a very important hormone which is secreted from the pancreas in your body, which helps to regulate the sugar. Now, what happens with type 1 diabetes? Now, these kids, unfortunate kids rather, they can't produce enough insulin, so the sugar levels go up and up and up, and which creates a hell of a lot of problem, like they have high blood sugars, for which they can be very severely dehydrated, and they can come to the hospital in a condition called as diabetic ketoacidosis. Also, it's important that the diagnosis of type 1 diabetes can at times be overwhelming for the kids, especially in the beginning. Suddenly, you and your child, depending upon his or her age, must learn how to give injections, count your carbohydrates, and also monitor the blood sugars. Sadly, there's no cure for type 1 diabetes as of yet, but advances in blood sugar monitoring and insulin delivery has improved the blood sugar management to quite an extent, and also has improved the quality of life of children and their parents alike. I'm going to touch on a very basic thing about type 1 diabetes today. We're just going to talk about how can you understand that your child may have type 1 diabetes at the onset. Because we have seen in many cases, the diagnosis is delayed because parents and the children are not aware of what to expect in case of type 1 diabetes. So today we're going to talk about what are the symptoms like. Children may come to you with increased thirst. They may have frequent urinations, which is very important. You may see a child to be bedwetting when actually he or she was dry before. They can come with extreme hunger, so don't play around and think that your child is becoming greedy suddenly. Its extreme hunger could be attributed to diabetes at times. Have you seen some unintentional weight loss in your kids? So that's something which should trigger a red flag. A lot of fatigue in children is very important to think about as well. Sometimes children may also have irritability or behavior issues, which is a concern at times. And a very theoretical, but we have noticed it, is fruity smelling breaths, odor. So that's not something which you'll pick up very easily, but then that may be a very rare symptom. But I think we'll work on three broad symptoms. First is frequent thirsty, frequent urination, and excessive hunger. So these three things, if they come together or in parts, you should be worried about what should you do next. I would probably tell you to go to your nearest pediatrician or pediatric endocrinologist and book an appointment. Talk to the doctors about your child's symptoms or signs. The doctor most probably will ask you for some blood sugar levels. Then, obviously, the blood sugar levels are on the higher side. Then the doctor will tell you what to do next. What happens in majority of cases is the children go unnoticed in the situation, and they can come with diabetic ketoacidosis, which is really an emergency situation when your child requires immediate intensive care admission and likewise. So we need to avoid those admissions. So the important takeaway point from this video is how to recognize early signs of diabetes and when to act. I hope this has helped you to some extent. We'll keep on posting videos about diabetes and other conditions of children, which may be of benefit to you and to the general community as a whole. Thank you very much for listening.